Well, I'm going to go ahead and get our program started. I just have a few kind of housekeeping introductory items for the group today. And I'm sure once I get through all of that, then we will have admitted folks and we'll be ready to get started on our program today. So again, like I just mentioned to you all, my name is Pam Lowe. I'm the Senior Director of Development here at the School of Nursing, and really glad that you all could join us today. So we have a couple of our fantastic faculty members. We have Dr. Pam Parsons, who's joining us today, as well as Dr. Kimberly Battle. And we also have a student who is joining us today, who's going to be talking about activities within our Richmond Health and Wellness program, and also through our prescription produce plan. So we've got a couple of topics on the books for today. And so I'll introduce who our guests are. We have Dr. Pam Parsons, who's our Clinical Associate Professor and Associate Dean for Practice and Community Engagement. She currently serves as the Project Director for the Richmond Health and Wellness Program and teaches faculty and students on topics related to geriatrics and interprofessional practice. And next is Dr. Kimberly Battle, Clinical Assistant Professor in the Family and Community Health Nursing Department. She teaches both undergraduate and graduate students with a focus on community health, interprofessional education, and social determinants of health. And so before we get started today, here are just a few housekeeping items for the group. We will be recording today's event. I see our recording button at the top there. That's so we can share with folks who were not able to attend our event today, but who had expressed some interest. And just so you're aware that you will only appear in the recording if you're speaking. So just to be aware of that. And after Pam and Kimberly have provided their presentation today, we'll leave room for some questions. We had a couple of questions that were submitted ahead of time, so I'll make sure that I touch on those first. And also, like I said, I recognize that we have some new names and faces on today's call, so I would encourage and welcome any of you to use the chat box just to simply introduce yourself as you're comfortable and want to share maybe your affiliation with the School of Nursing or VCU if you're a community member. We just appreciate knowing who's joining us today. And so we'll also be monitoring the chat box for questions. If you have any questions that you want us to ask, welcome to pop that in the chat, or at the very end, you'll be able to unmute yourself as well. And I'd also like to make a quick introduction of my team. So again, I am the Senior Director of Development here at the School of Nursing. So I am charged with all things related to alumni engagement and fundraising. And the newest member of our team is Laura Keller. Laura, if you want to have a quick wave there. She just joined us in the last couple of weeks as our alumni engagement coordinator. So her job is going to be connecting and engaging nursing alumni to our school. Catherine Stein. Catherine, you can give a quick wave. And she's our scholarship and stewardship specialist. She handles our scholarship process, coordination with scholarship recipients and stewardship initiatives. And Talise Owens, a quick wave. Hey, Talise. She's our development specialist. So she's in charge of stewardship activities, donor acknowledgements, as well as is our event logistics manager for events just like today's virtual event. And also a quick hello, our dean, Jean Giddens. She's on the call today, and I just wanted to give her a quick chance to say hello. Jean, if you want to unmute yourself.
Thanks, Pam, and welcome everyone. I'd like to echo Pam's comments about being delighted to see all of you join us today. One of the things I just wanted to say out front is how proud I am to be the dean of this school. I think what you're going to find today is what an impressive program that Pam Parsons and Kimberly Battle are involved with. I have seen this emerge from several years ago as more like a seedling to this really robust, amazing program that has actually become a signature program within not just the School of Nursing, but across the university. So it's people like Pam and Kimberly and our other faculty and staff that make this program what it is, that just gives me such pride in our School of Nursing. And I'm sure as you hear this, you will also feel that pride as well. So Pam, I'll turn it back over to you.
All right. So what I think we're going to do next is Pam Parsons, you've got a slide deck. So we'll just get that teed up here shortly. And once we've got that up and running, then you can take things from here.
Okay,
All right. Looks like we are.
ready to roll.
All right. Looks like
Okay.
it. Take it away.
So I was charged with the title, which is How the Richmond Health and Wellness Program is Creating a Healthier Richmond Community. And Kimberly, at my request, has offered to help with talking about how we're integrating service education and a little bit of research into the project that we have that's so community focused. Next slide. So I wrote some objectives. I don't need to read them, so you can understand where we're trying to go in this short period of time. And next slide, please. So there was a similar discussion that we had with many of you on a call about 2 years ago, I think, or a year and a half ago, around the RHWP program with a focus on social determinants of health. So many of you are familiar with our program, and I did not want to replicate the same type of information. We are more than happy to engage with you all to have a further discussion of the background around what social determinants of health really are and what the health disparities are within the Richmond community and how our program activities actually take place on a daily basis. But I did not want to be duplicative of that as we've done in the past. So I'm just giving you a couple of slides as reminders and then moving forward with the fun part of the discussion for us, which is what's been going on since we last came together and where are we moving forward, hopefully over the next years to come with our program and how we touch the community. So I will remind you of what is a health disparity and making sure that people understand that it is connected to what people call the social determinants of health and on individual social needs, and how where you live really matters and what those resources are that you have to maintain your health and well-being. Next slide, please. I'll also remind you of what the RHWP mission is. This is one of our teams in action at the Health Hub, and it's to improve the health and well-being of adults across the lifespan while reducing these health disparities. So that's what we're all about. Next. This is the services that we provide. I won't read the list to you. Again, we are on the academic side of our university, so that these are around teaching people how to do self-management, how to do risk assessment for their social needs or their health needs, and then how to put plans in place for them to improve their health with some actual behavioral type of goals, as well as referring them to the services that they need. These are two cool pictures of individuals that we just took very recently that participate in our program. And I will stop to say, so I'm going to ad lib it, of course, as we go, that we had someone come out to take some photos for a project we're doing with AARP. And it really touched my heart that people that we didn't ask to take their picture, everyone wanted their picture taken. So this was just in the last couple of months. And I think people have been so socially isolated that they really wanted to feel like they were a part of something. And we were pretty proud of that, that you can see that there's even a proud reflection on this gentleman's face. And we're just happy that we can be there and happy that they feel like they're working with us to improve their health. Next slide. This is the model, which people, if you've been with us before, have seen over time. It's just a reminder that how do we work? We are started 10 years ago in apartment buildings across Richmond that are dedicated to low-income, older disabled adults. We are in 5 buildings. We added a building recently in the middle of COVID, just last semester, called the Rosa. And it's down in our urban setting again next to VCU Health, and we are at the Health Hub. You can see some of the partners that we have on the left that we work with to get our services connected for individuals. And then you can see all of the different kinds of students that we train and how we're tracking outcomes with the hope of improving health equity for our community as a whole. Next. Reminder that we do have a framework conceptually to guide our work, and we're constantly adding new little boxes of things that we feel like we have expertise in, where we train the students. We have some evidence-based ways that we assess the residents around their needs so that we can help coordinate the care and help them with a healthier lifestyle through the coaching that we do and the goals that we set, and then a way to track our outcomes. Very, very proud. On the right side of this, you'll see age-friendly health systems designation. This is a national recognition from American Geriatric Society and the John A. Hartford Foundation in congruence with the Institute of Healthcare Improvement. It is a big deal, and they usually designate these certifications to or award this recognition to health systems on the acute care side or outpatient primary care settings, nursing homes, those that are really within a structured type of care system that have a way to move across and track outcomes more clearly. So the fact that we have a process where we're in a community-based setting and we can track outcomes that are measurable for them for impact has mattered, and we are so happy. This is the highest or the next to the highest level of recognition that you can get from IHI, and we're very proud of it. Next. So now we get to say, what have we been doing? So what have we been doing recently? So during the COVID shutdown last year, what we did is, at the request of the VCU Health System, partnering with the Virginia Department of Health, we made a pathway so that our RHWP team could work with the interprofessional students. We actually led the initiative. Kim Battle was very key with this, as well as Kathy Falls and Genevieve Beard, other faculty members, Anna Diallo, that work with us, so that we could provide vaccines to individuals in the East End of Richmond through the Health Hub, where people that are from Black and brown communities and have issues around transportation, et cetera, and maybe some trust building, could actually come to us and we could help them with their vaccines. It was great training for the students and great for us as a whole. We love doing it. We're very proud of it. We've moved from doing vaccine clinics to having a official relationship with the Rhwp Pharmacy, which is connected across to the Health Hub, so that we can help them sustain their business model that they have by going forward with our faculty and students being able to support them to provide vaccines and education and help people with literacy needs get registered. So this is a very great partnership. In the fall, we'll be able to help with flu vaccines and other types of things that come up. And it's very, very good for Rhwp Pharmacy. They're very pleased. We're very pleased. VCU Health is pleased. The community's pleased. And we've done over 4,000 vaccines to date. And we are so happy about that. Next. I also want you to know that there's always this piece that we do too, which is kind of fun for us in academics, which is around research. So when, I think I might have mentioned this last time, but when the COVID pandemic first occurred, there was some internal effort for funding for people or units that wanted to do any type of research. A lot of them were based out of medicine around pathways for treating COVID. Ours and some others were focused more on social aspects around this. So we started with some internal funding from iCubed, where we had interviews from a newly developed evidence-based survey, I'll say, because it's being used nationally to try to understand people's needs during the pandemic. So that was 100 individuals that we did. We turned right around and we got some additional funding because we had heard of an additional need from the community out of the mayor's office, from Senior Connections and Resource for Independent Living, to more broadly take a scan of the community as a whole, and not necessarily only focused on RHWP residents, but those as a whole of, and what their needs were. So we've had those two pieces. We've had 2 manuscripts accepted. I did not lead them. Our other team did, which I'm very pleased to say that that's happened, that this really is a collaborative approach. And we're now finishing that report to the community agencies from the second phase of our work. And within that, you can see, can you go to the next slide? One of the main issues that did come up, which is not to be a surprise, is that people in our qualitative portion of our study came up with a lot of issues around mental health and the emotional impact of what this is. So this is just some excerpts of what some of the statements were that we have had in our feedback that we did use when we went to publish as well. But just a minute. Whoop. That's okay. I was just going to make sure people had time to read that, but they probably can. But as you would think, depression and anxiety are really were on the rise during this time. And they're still there. Next slide. Also, we're proud of the fact that we were able to sustain our RHWP visits during COVID. I think we mentioned that a little bit last time with converting over to having a telephonic platform mixed with having a REDCap database and being able to connect by Zoom. We have had in the last year 2,423 visits. Within that, some of them may be repeats, but that's what we like, so that we do stay totally engaged. In the last quarter of 2021, we had 719 visits alone, and of those, there were 375 people that touched RHWP. And what that means is that we are re-engaging more fully, and people are starting to come back in touch with us. We are reopening our engagement in our buildings. We are continuing our AARP work as well through assessing social determinants of health. Next. So I am taking a little longer to talk than I thought. I always do that. So here's another cool thing. This is where we're going. So setting the stage for where are we going with RHWP. We've been working very, very closely with VCU Health System on what their identified needs are for supporting the people that they serve out of the health system. That, again, 7% of those individuals reside in our highest poverty area in the city, which is the East End, and they have a lot of social needs. And so how could we do that more fully together? So working with the Office of Health Innovation, Cheryl Garland, who's the Chief Impact Officer for Innovation, as well as Dr. Arlene Bohannon, who is the physician in charge of complex care. And what we have done is had some pathways created where we could add an RN case manager. She happens to be this faculty member of ours, Dr. Genevieve Beard, who is piloting this work for us to help get the model up and running. And she is a contract worker across to VCU Health System, even though she lives with us on our academic side. We've also added a community health worker through another grant initiative so that this person actually can be embedded in the community while they are also within our workspace, so that they can touch people in a different way to make sure that trust building is there and they understand what the community individuals' needs are. So these are huge around new social models of care and how you can do integration across to more fully take care of individuals. Next. Within that new framework that we're creating, there are some new technology platforms that we will be using. This is also quite huge and extremely exciting. One of them is the Unite Virginia platform, which is part of Unite Us. Within the Unite Us platform, there is an evidence-based tool embedded within it that captures social determinants of health. There are lots and lots of agency partners across the city and the state that sign on to use the platform. You can do assessment and you can do referral within the platform. And then you can also track whether or not the person connected. There's even ability within that platform for us to deal with any issues that might arise for people that need assistance around trauma-informed care. And so we're very, very proud of that piece. We are getting that finalized right now with legal review. I'm going to have to take a sip of water, sorry. So that we'll be able to fully use that for our faculty in RHWP. The other is that the VCU health system transferred over to the EPIC system for charting, which is a hot mess. You may or may not know, as we are readjusting on the health system side to a new electronic platform for charting. The big deal is that there's a way in there that's to be created so that we can actually communicate with providers about the care needs of individuals. Hugely missing in the past, and that's the missing link for coordinating care and making sure people don't fall through the cracks. Next. So around this brand new model, these numbers don't look very high, but Genevieve just started in the late fall, and we really only have 1/4 of data to date. And she's only there part-time, so this is not a full-time job for her. So it's very important that we do track these outcomes. We have more data around utilization that we're getting ready to report in March back to the funder. But you can see that we've started already with her limited and late embedment within RHWP as the care coordinator. She's had 42 encounters. She's there on Thursdays and Fridays. 10 people have been referred to primary care, which means they come in the door without a primary care provider. And then 12 have been connected across to care. There are very high social determinants of health needs for these individuals. The majority of what they're seeing is around people with housing instability. But again, we have our medical legal partners. I think there may be someone with that partnership on the call at this time, as well as lots of issues ongoing around food insecurity. Next, please. So this is the exciting part. What is next for us? Can you go to the next slide, please? So as we're moving forward, all of a sudden it's December and a call comes out for a grant. And it's always scary when we, Dr. Salisbury, who's the Associate Dean for Search, and I hear about a grant, because does it fit our work? And then it's hard for us not to get excited about it. So this call came out in December, and you can see reading what the focus is. It is to take programs that are focused on care coordination and training nursing students and how to better do services around care delivery, focus with a foundation on social determinants of health, cultural humility, and other factors that actually increase or impact health equity over time. Next. There are some expectations that you can see. One of them is that you, of course, it's a HRSA nursing grant. So they're saying we want workforce training, and we want our next generation of nurses to be able to do this better. And one of the things we know you have to do is to have embedded longitudinal training for the students. All of these things that I just named to you align with the Future of Nursing report for 2030 and the new approach and design for curriculum change that's come out from the AACN Essentials. So all three of these things kind of fit together. Next. So where are we going? We named it because when you put in a HRSA grant, you have to name it. We named it the Mobile Health and Wellness Program. Next slide. It looks like this, and I'm not going to stop and explain this slide until the end, but this is a beautiful model picture that Dr. Amy Salisbury, the Associate Dean for Search, created for us to use for the grant. So it looks complicated because it is. Next. And what was the purpose? What do we have to figure out that we were going to do? So we know we wanted to take RHWP and care coordination. We know we needed to train nurse practitioner students. And we know that we have a desire through VCU Health System and for training students across interprofessionally how to reach our rural populations, particularly as an academic practice partnership where VCU Health System has acquired the hospital, Community Memorial Hospital that's down in Mecklenburg, the Tappahannock Hospital that is up in the Essex area. We have Petersburg area that requires, it's got one of the worst scores for people's daily quality of life and health outcomes across the entire state. And then there's a large Hispanic population or Latino over near the South Richmond area where we have the Hayes Willis Clinic. When we went to put our grant together, they said you must look at this national data to say, are you really targeting areas that have a social vulnerability index, which is focused around social needs for individuals and then related to the health outcomes? And lo and behold, all of these areas that you see targeted on this map are in the darkest blue area, which means that they are in the areas that really need the most assistance to improve health outcomes in daily lives. Next slide. So we had another cute little chart that Amy put together for the grant. And that is what was going on in those target communities we just talked about. There are evidence, they're called MUA, which is medically underserved areas. So there's a lack of care providers. Transportation is huge across all of those settings, whether they were the urban area or the rural areas. There is a need for increased preventive services, increased need for care coordination and navigation. Mental health service was a high mark across all of the areas. There is no trust within or a need to build trusting relationships across so that people can move about to get the care that they need, and they need affordable care. Then there's what do we need to do in our with nursing education. So through the Essentials and the Future of Nursing, there's a more directed incentive for us to integrate social determinants of health across all of our curriculum so that when students graduate, they understand the role of social determinants of health in the care that they provide. There needs to be much higher integration of behavioral health into other settings, not just within our psychiatric mental health courses or our nurse practitioners that are focused only in that area, but how do we more comprehensively integrate that within the training for students and the care that they're able to provide, as well as we need to make sure that we're innovatively helping our students learn to put all of these skills, use them in a synthesized way with critical thinking, and to learn to be leaders, and again, to increase the diversity of our workforce. And I think you can read these things on the right without me going through them. Their goal is for us to take some of this work and move it into these communities around these issues. When I was shocked, actually, when I looked at the report from the Board of Nursing for last year, that only 9% of the nurses that we have in our state work in a rural area. They all, of course, go, that's nice, I lived here, I'm trained here, but I'm going to go into a more urban or suburban area to work. So we really need to change that mindset of what population health is all about, and that it there's a lot of value in working in those rural communities. Next. So how are we going to do that? So there's two phases that we've incorporated into our grant. One is that we would take RHWP on wheels, called again the Mobile Health and Wellness Program. One is that we would provide a van that any of us could get in and drive to take our services that are care coordination and case management focused into the communities that we just targeted. So 4 targeted communities. This is the van that we've been looking at, and it's something that's moderately affordable for our work. But we're really hoping that we're going to be able to use this type of van to provide those services. Next. And this is a monster van. So this van, I have some friends at the Capillary Health Network, which is the local FQHC here. Tracy Causey is the CEO. There are 9 FQHCs in our Richmond area. They happen to have this very large van that is not in full use. So if we could partner with them, which HRSA really likes, we could take this van into our rural areas to provide primary care at the site with our faculty nurse practitioners hired through the van, through the FQHC established care processes, train our NP students, do the care coordination at the same time outside of this van where we're doing the primary care, but next to it, and have a truly fully integrated model where we're meeting lots of needs for lots of different people across the lifespan. Very excited about this opportunity. Next. We also have the practice partners that I just named to you. Next. We also have some academic partners, which is why this grant is so complex, because couldn't be just satisfied with one thing like care coordination. No, we have to do primary care too. And we need to try to really expand what we know of as the needs for workforce training in these rural areas. So Rappahannock Community College and Southside Virginia Community College, one is located down in the area next to Community Memorial Hospital in Mecklenburg, and then Rappahannock Community College has a site up in the lower Essex area that's near Tappahannock, so that we now have a pipeline for training those students, enhancing their curriculum while we're training our students, and a way to enhance collaboration across while we design these models together. Extremely excited about that.
Can you take them to the ED? I think having a monitor on wheels per se available to
Thelma, I think that was Thelma asking a question, I think. I'm not sure. Pam, and I think you're muted.
It did that for me.
That's
My computer decided to do that.
okay. I'm not sure if Thelma had a specific question at this time or not, or Pam, if you wanted to keep going with your presentation, and then we can revisit that question at the end.
Yeah, I'm almost done, and that'll bring the story together, and I'd love to have questions.
Yeah.
So these are our community partners in each of those areas. So we have a local YMCA down in the Mecklenburg area. It's called the Mecklenburg YMCA, where we can park our van to do our services. We have the Bay Aging, which is their area agency on aging that's near the Tappahannock area, but they're a very strong community force in that area. So we were guided to them. Gilfield Baptist Church is in Petersburg, and Dr. Bohannon connected us with them, and they would be happy to have us come there to park and provide our services with them. And then Richmond City Health District is going to help us with reaching that area of the Latino population that's near the Southwood apartment buildings that's next to Hayes Wells Clinic. That's the proposed model. Can you go to the next slide, please? And then one of our great outcomes would be if we did get funded, if we got funded, then we would be able to train many students over these 4 years. We could do 84 nurse practitioner, family nurse practitioner students, 80 total of the BSN students, and then 16 students from our community colleges. So that would be a wonderful way to expand our workforce training. Next slide, please. So now I'm going to go back to the picture so that maybe it makes sense to you. 2 vans. The big one at the bottom is the con van that would do primary care. We would go from one site to one site each day a week, except for the additive piece of the primary care. It would be 2 days in the Tappahannock, Essex area in the first couple of years. And the last year we would add in a day in the Mecklenburg area. It was a specific request from the CEO at Community Memorial Hospital that we please try to do primary care in that area. I wish we could figure out how to do more intense primary care there as well. I have some ideas, but they aren't in this grant or they're not on the slide at this time. So I think this might make sense to you now when you look at this picture that I've described the component parts. I think it's a beautiful picture, and we're very, very excited about the possibility of what this could be. Next. So this is who we are. These are some very recent pictures, as you can tell, because people have masks on. And this is where we're going. Hopefully, one way or the other, if we don't get funded, we need to figure out a way that we can at least get our van moving so that we can start to touch some of these populations with expansion of our model to those that are the most needed. It's the right thing to do. It's been the driver for what we do over time. And we're just looking forward to putting something in place that's a part of this if we're not funded. Next time. And it's Kim Battle's turn. Thank you for listening, guys.
Hello, everyone. So the significance here of our prescription produce plan is this was a natural evolution where many schools will have prescription produce plans now. But what is unique here at VCU is this plan is housed in the School of Nursing. Please, next slide, please. So our objectives for our prescription produce plan, that we commonly refer to it as the PPP, we wanted to evaluate the influence of behavior change related to chronic health management, self-management in our older adult population. We wanted to have an impact on our participants and evaluate their quality of life, their perception of their quality of life, as well as look at how the PPP plan with the interaction of the advanced practice nurses or our nurse practitioner students, their perception of their role transition by prescribing these lifestyle modifications centered around the social determinant of health and food insecurity. Once we provided the prescription, the produce bag to our older adult population. Next slide, please. So what we learned that the nurse-led interprofessional educational teams worked fabulously. We were able to see the leadership skills and how the nurses, both BSN and nurse practitioner students, interfaced with our faculty, along with under the guidance of faculty engagement with the participants. And there was a buzz, simply put, that was created with our prescription produce plan. We saw the feasibility of this plan from initially starting with just 1 to 3 or 3 people in the plan as our participants to growing and having this feasibility interacting as well with 2 research assistants that we had involved with our produce plan, resulting in 250 prescription bags being utilized by our participants through the course of this program. We also further solidified our relationship with Shalom Farms, our community partner, they were very instrumental in the implementation of our prescription produce plan. You want to have the next slide, please. So keeping in mind that we implemented this prescription produce plan during the pandemic. So this is a picture here of that shows Shalom Farms. They have a truck and they park the truck outside and unload the truck and set the stands up with the produce there for people to come and shop for their vegetables. And you can see with the sign there is a sign that says SNAP or EBT welcome. For our purpose, you can have the next slide as well. Here's another slide of them, of people showing and shopping and filling their bags as well. And another slide, please. this is another slide as well. So we had with this being the pandemic, the students were very instrumental in assisting and coordinating with the distribution of the produce plans, of the produce bags, bringing them in from the truck, distributing them during the course of their visits, going over the contents of the bags, introducing, providing educational information regarding the new fruits and vegetables that may have been unfamiliar to some of our participants, and how to prepare them, and the benefits of trying to increase their vegetable consumption as the participants work to self-manage their own chronic health conditions. You want to hit the next slide, please. Some of our findings from our prescription produce plan participants, we found that 57% of our participants had less than or equal to a 12th grade education. And with our chronic health conditions, many had multiple health conditions, with some of the top chronic health conditions being arthritis, hypertension, diabetes, hyperlipidemia, and obesity. You want to have the next slide, please. The scales that we utilize to evaluate with our participants for this prescription produce plan, we had them all participate, do an initial USDA food insecurity questionnaire. And the scoring on this one, the higher the number would indicate a potential lack of access to daily caloric intake of 2,100 calories a day. Then we also looked at pre and post of LORIC's self-efficacy for management of chronic health conditions. We had the evaluation of the resilience scale, and we utilized the CDC's health-related quality of life scale as well, where the participants estimated their recent days over the course of a 30-day period of their the number of days that they were physically or mentally healthy that were good, as well as the converse of any of the amount of unhealthy days over that 30-day period. So our next steps in future direction is looking at the measurement and outcomes of evaluating the participants' evaluation before and after their participation with prescription produce plan. You want to hit the next slide? The next slide, please. So our future direction is moving our prescription produce plan from simply distributing bags to incorporating the distribution of dairy or meat, to also and expanding to a food pantry, where we would have this to support the continued sustainability of the practices of incorporating and education that they learned from participating with our student nurse led interdisciplinary education teams. Additionally, the sustainability that we incorporated also with service learning projects that were in the community health course, where students had developed recipe books, simple, straightforward recipes, having about 5 ingredients for the participants to prepare the fresh vegetables that they received, as well as a brochure flyer regarding healthy eating, the do's and don'ts, and how to improve their dietary intake to self-manage their chronic health conditions. So at this point in time, I would like to introduce Jessica Fry, who is a nurse practitioner student in my clinical nurse practitioner, family nurse practitioner cohort group. And she will discuss and share some of the things that she learned while participating in the prescription produce plan. Jessica?
Yeah, good afternoon. My time working with RHWP in the prescription produce program, I just got a much better sense of the social determinants of health and really put a face to these things we talk about. By interacting with the population we were serving, I learned a good deal about the people that were living with food insecurity, depending on food banks, church donations, and easily accessible stores, which might be convenience stores. And by spending time with the prescription produce program, I was able to appreciate the interplay of access to food, environment that my patients live in, and the impact that food has on disease management, and how that affects my patients' perception of their own ability to manage their health. In primary care, where I hope to work and where I've done some clinical time already, at our annual exams, we talk about cholesterol, blood pressure, glucose, and weight, and we might say, okay, eat healthier. But this program really gives us an opportunity to practice talking about good nutrition and what that means, how to plan meals, and get back into cooking. And we provided that food to them to give them the opportunity to practice the things that we talked about. And by doing all of that, we're showing them that the food choices they make every day can make a difference on their health, which allows them to feel proud of the choices they're making and feel that they can make a difference for their own health. So going forward as a student who hopes to work in primary care, I found that talking about nutrition didn't take as long as I thought it would, and that food is the medicine that my patient will take every day. I feel more confident to say that food choices we make every day make a difference, and there's something you can do non-pharmacologically for your health. And I also learned that talking about access to food, the ability to store and prepare meals, and the community my patient lives in is important for understanding where that patient is coming from and advocating for change within the community that I hope to serve. Thank you.
Kimberly, I didn't know if you had any final thoughts or any closing comments from what Jess just had to say.
The closing comments from what Jessica said, Jessica expressed one of the main reasons for developing the prescription produce plan of integrating the students' involvement, our nursing students' involvement, of having this experience of evaluating up close and front of the impact of the social determinants of health and how we can mitigate through our education and our community involvement, community partnership of alleviating, addressing this food insecurity and improving the clinical outcomes with our populations as they address the self-management of chronic health conditions.
Right. Yeah, no, I appreciate that kind of helping to wrap us up there, Kimberly. And I think from here, what I'd like to do is say big thanks to Pam, Kimberly, and Jess for your time today. I think hopefully all of you on the call gleaned a good amount of information about the activity that's going on. It's very impressive to me to always hear what the activities are and what new projects are on the horizon. And before we move into a few minutes of question and answer time, I did also want to just note for anybody who might be even curious on this call today, that projects like the one that Kimberly Battle is working on is funded in part through donors to our Clinical Scholars Fund. And so this is an opportunity for our clinical faculty to be able to apply for different types of grant awards. And so Kimberly was one of the recipients over the past year. And so congratulations to you on that. So appreciated being able to hear an update on that. And also I wanted to make sure that while Pam Parsons is a very prolific grant writer and does a terrific job with that, I also wanted to share that her work is also funded in part through the generous donations of multiple folks who give to our Crystal Goodwin Community Engagement Fund, which is very helpful to Pam and her work and being able to meet needs that perhaps are not able to be provided through the different grants that she writes. So I just wanted to provide a little bit of funding context on that side as well. So we have about 10 minutes left. We had about 3 questions that were submitted ahead of time, and I'm going to read them off. And between Pam and Kimberly, you all can feel free to provide some answers for us. So the first question is how have you brought different care settings to the home?
When I hear care settings, I think about the way that we actually do home visits and the way that we're expanding across, not to actually just only be in an apartment building, but also that we are now in a community-based setting. We were surprised to find how many people actually walk to the health hub to get the services that they need. So that transportation again is huge. I think we're starting to take a move, and I think there's another question around how we're working with perhaps some technology devices that I had mentioned next at our last visit, our last talk. So I'll integrate the two responses there. We are in some of the buildings dispersing some technology equipment and developing some pathways around how to use those devices for individuals with some education around that piece going on. There's also a strong research arm from one of our other faculty collaborators, which is Dr. Jane Chung, and being very intentional about how we take that technology into the homes and make sure that people are trained on the use of it, and that there's some standardization across. So that deployment and the integration around that piece has taken a little longer than we thought, but it is still moving forward. And there is that research piece to standardize what those pieces going on. So that technology piece is in place. We are not able to do a health visit because we are on the academic side. So from the remote patient monitoring piece of this, when or if we were funded through with our CON network, we would be able to do telehealth visits in those settings through that relationship with CON. It's a funny piece over time, building academics and health system practice together.
All right, terrific, Pam. And like you said, you kind of wrapped that second question, I think, nicely into how you just answered that. So I'm going to move on to our third question. And that is, what are some opportunities for alumni to be able to volunteer with the RHWP? And we're prepped. We're going to also, in addition to answering the question, we're going to pop a link into the chat for those of you who might be curious, so you can find out some additional information. But Pam, would you like to kind of share your thoughts on that?
I would. So we've been struggling over time with the correct pathway to have people that are alumni or others volunteer with some of the work that we've done. And I have had some leadership insight at the university level. How did I say that? To help us with making sure that we actually are able to do this, and there is a clear process defined. Took lots of different people to get to answer the question, and they had to do some digging. So in the chat box is a link to a document that if you did choose to volunteer with us at our sites, there are lots of different ways that you can volunteer around our food insecurity projects, some of the food distribution that we do, working with the project that Kim Battle is leading around the new course for service learning that's going to develop more than just food insecurity, but looking at how people have different kinds of needs in the community. So there's lots of ways that people could come in and volunteer and be at our sites. I know I had approached some lawyers in the past and said, wouldn't you like to volunteer with us? And they had said yes. So we really do have that pathway around the medical legal practice law arm. And there may be ways, if there are those that are interested in doing that, they could volunteer through that pathway. But we do have to have some structure around it. So there's the form for you all to look at if you're interested. VCU Health System has a more stringent pathway for volunteering than we do on this side. But if you just call our office, which is 804-828-051, then Jonathan and Jason are on the call. They can get you engaged with us, and then we could have some conversations and get your paperwork done, and you could come and play with us.
Hey, Pam, do you mind repeating that phone number? Maybe one of my team members, maybe Laura, could just type that into the chat box real quick. What's your phone number?
804-828-. Did I just mess it up? 804-828-0521.
All right, thanks.
Thank you.
We just have a couple of minutes left, which would be a time for maybe a question or a comment. If anybody on the call wants to unmute themselves.
Hi, can I ask the question?
Sure.
Yeah, I'm Krista, and I am a new faculty in family medicine. I'm a nutrition epidemiologist and a registered dietitian. And my previous work in other university, it was working with communities to change dietary behaviors and towards obesity prevention and and other chronic diseases. And I worked with a lot of immigrant and underserved communities. So I really commend you for all this work, and I'm actually looking for collaborators to do my research as well. So specifically for the prescription produce plan, which is really amazing. So, but I have one question. Through your all this experience working with the community, what do you think, besides the financial issues, other barriers to actually, eating healthy or shopping, or, is it storage? Is it space? What is the more salient issues or barriers?
So I know Kim Battle's supposed to answer that. I'm gonna say two things real quick. One is there was a pilot program to give out food boxes, working with Feed More on the health system side. And if Cheryl Garland's on, she can attest to that. And oh no, we went to give out the boxes and we realized people don't even have a can opener. So there's things you don't think about of people's daily lives when they're underserved. And then also Doug Pick with Feed More, there was a year where he had a robust inventory of turkeys, and he wanted to give all the turkeys to all the people that we take care of. And then he realized they don't have anywhere to store the turkey, and they have nowhere to cook the turkey. So I think we just don't have a good understanding of the challenges. Kim, do you want to add?
No, I concur. Really, the challenges with food preparation and storage. As part of our PPP program, we also gave everyone a crock pot just to help with the food preparation. Then we found that storage became an issue and when we say storage, we mean actual storage containers, as well as the physical space as well. Yes, so I think it's all of the above.
Yeah, I found the same thing
multitude.
in my own research. Yeah, that's what I was asking to see if, same things are here or what other things you might have discovered. Yep, thank you.
Yeah, appreciate you asking the question. And I do want to be respectful of everyone's time today. We've got Pam's phone number listed there. And if anybody wants to have a follow-up question for Pam or Kimberly, feel free to reach out to them directly, or anyone in my office will be happy to facilitate that as well. But I really appreciate everybody's time today, and thank you so much for joining us.
Thank you for the opportunity to share.
You're really
Thank you all very much.
Thank you.
Yeah, you're welcome. And Talisa is going to be sending out a post-event survey. I appreciate your help to fill that out. That helps us to understand what you appreciated about the program and what other offerings we can provide. Thanks.